And on today's episode, I'm so excited because we're going to have a very special guest, Dr. Dan Kalish, with us. And welcome back, Dr. Joe Gambradella. Today, we're going to be talking about the three body system approach to functional medicine. And we're going to have two parts to this. So we're going to start with the first part and then we'll roll into the second part. You ready?
Ready.
All right. So, Dr. Dan, you want to give us a little brief history of you and how you got involved with functional medicine?
Yeah, for sure. So, about almost 30 years ago, I did something a little crazy. So I went to Thailand and I ended up checking myself into a monastery. And I lived in this monastery for 2 years with the monks. It's called a forest monastery. Not the best hygiene in the world. And one of the things I came back from that experience with was chronic fatigue. And I couldn't figure out what the problem was, went to see all these doctors, finally found this functional medicine doc, and he diagnosed that I had this parasite that I picked up in the jungles of Thailand and got it treated. And the day I got it treated, I got my whole life back. And I thought, hey, this is what I want to do for a job. So I ended up, getting trained in functional medicine. I had the really great fortune in those years of how just being in the right place at the right time. San Diego, California in the 90s was where all the top functional medicine docs were. So I had mentors left and right to train me for that decade. And then I went out 2006 and started my own training program based on the work that I learned from all my teachers. And so now for quite a while, almost 20 years, I've been a prominent teacher in the functional medicine space. And I think what I've really tried to focus on is creating models that patients can understand and doctors can learn to use, because functional medicine needs to be demystified and simplified and understood by people. And that's been kind of my key role in the industry, I think.
Yeah, that's great. I was just telling Dr. Dan, Dr. Joe, before you got on that Buzz and I and you, we're actually listening to Dr. Dan Kalish before you guys joined his group.
We had a bunch of
So,
YouTube contests we
yeah.
listened to because, Joe and I practices are mirror images of each other. And we actually, Dan, tried to do functional medicine. I think I told you 10 years ago. Um, but it was no one had set up a system that was easy to follow. So we had done some trainings on it and we just couldn't figure there was no system to it. So we kind of abandoned that. We actually did a bunch of testing on patients too. We kind of didn't follow up with them either, which was not good. But we couldn't. There was no system to it. And another friend of mine, Dr. Matisic, um, I mentioned him. I really want to do functional medicine because I know the great benefits, and I knew my patients needed it. And Dr. Matisic is like, "Oh, you got to get this Dr. Kalish. She's got it's a really good system. It's it makes a lot of sense." So that's when I started watching. Me and Joe started watching on YouTube and realized, man, this is exactly what we needed. You had a really good reputation. I think you'd worked with the Mayo Clinic and some other places and got really good results. And we wanted to be consistent with our patients too. If we're going to bring something in, we didn't want to be willy-nilly. We wanted a system to follow, and that's what we found with you. And we're really feel blessed to have picked this up. And the results we've been getting with our patients have been simply amazing.
Mm.
Don't deviate from the system. Do the testing. You find some crazy stuff on people that you wouldn't expect, but it explains why they have these crazy problems that we couldn't correct in the past. So we're very excited to have you on today.
Yeah.
Yeah.
And
Yeah.
also, I just want to throw out there that you're easy to listen to, which I like. And I could process everything you were talking about. So it was really fun to listen to you. But let's go ahead and get started. And for our listeners, I want you kind of explain what is functional medicine?
Yeah, I think functional medicine is most popularly described as root cause medicine. So finding out the why there's a problem versus trying to diagnose what the condition is. And it's also sometimes referred to as systems medicine. So we're not looking at an individual patient's specific problem as the problem, but looking at an integration of these different body systems and seeing where things are falling apart on a more interactive level of these as these systems are interacting with each other to generate symptoms eventually. So it's not symptomatically oriented, and there's no single treatment for this thing. It's not like, oh, everybody that has a headache is going to get, an Advil or something like that. It's like, oh, well, why is this headache happening? Is it because of the food you're eating, because of the kind of exercise you're doing or not doing, or is it something that's going on with your liver or your brain? So we try to emphasize lab test based programs to determine what these underlying causes are. I think that's really to me, it includes lifestyle medicine, but lots of people do lifestyle medicine. I think the special sauce to functional medicine is that we have these complex labs that we can run that we can interpret to really get to the root cause reason why people aren't feeling well.
Yeah.
I think they fit good with us too because Joe and I had a big bioidentical hormone practice. And it was kind of like we always just said to test didn't lie. So you only do hormones if you need it, but you test to see if you need it. You don't just, everyone doesn't need hormones, obviously, but the test doesn't lie. And that's where functional medicine is too. Like you do the test. If you're good, we don't touch you. But if we find something wrong, it won't fix itself. So then now we have the tools to correct these problems, because at the end of the day, I think, when it comes to health, I think Joe and I look the same way, and you probably do, Dr. Kalish, is the body always has the ability to heal itself, and we all should feel great. So if you're not healing and you're not feeling great, there's something wrong. That it's not normal not to feel good. It's not normal not to heal. So it's our responsibility as physicians to figure out why the body's not healing and why we're not feeling great. And that's what these tests allow us to do.
Yeah, and you mentioned body systems, and I
Mhm.
know that when we're explaining, I'm always telling people, actually, I'm a huge fan of functional medicine. So I'm always telling people about the three body systems. So tell us about the three body systems.
Yeah, so this is the basic clinical model for how we approach understanding any individual symptom, which is there's three potential systems that can go down. Number one is neuroendocrine, number two is GI, and then number three is detox. So neuroendocrine means all the command and control systems like your brain and your hormones and your energy systems. And then obviously your digestion is your microbiome and all the things that we associate with the gut. And there's lots of things that can go wrong with your gut. You could be eating the wrong foods that damage your gut. You could have infections in your gut. Lots of stuff can happen there. And then detoxification refers to what's built up in the system. What is your system not able to get rid of? Whether it's an environmental toxin, it's a heavy metal, it's mold, whatever it may be that's in your tissues that shouldn't be there. And when you look at most complicated functional medicine models, you can actually break all of them down into these three body systems. And I think it's easier to work with the three systems. It's easier for patients to understand. It's easier for doctors to organize their treatments when they're not trying to do 1,600 different things and they don't even know what the sequence or order should be. So having a systems approach, and it's something that's common sense that we do in many parts of our life. We have systems approaches for all kinds of things. Even for how you bring your car in and your car's not working, they're not going to just start from scratch and rip your
Mhm.
car apart. They're going to say, oh, we're going to look at the fuel system or we're going to look at the brakes or whatever it is. Everybody that's trying to fix things has a model and a way to look at it from a system standpoint, except medicine doesn't do it that way. We look at the symptom as its own problem and don't look at the context in which it's coming from. So I think that's really what the systems approach is for.
I like Dr. Dan too, how you made this really digestible, not only for the patient, but for the doctor. A lot of the questions that I get is, hey, well, how come no one's ever run these tests before? Like the difference between traditional medical and functional medicine. Like this is a team where you have medical doctors, naturopaths, chiropractors, all working on the same team. But yet I just got today, well, this is so life-changing for me. How come no one ever ran these tests before? So it's an area that's exploding, but it's still an area that people don't have a lot of information about. And I like the way it fit into our model because you said, hey, well, listen, just about every symptom that you have for a patient fits into this functional medicine model. You call it your big five: fat, fatigue, depressed. There's something going on with the gut, and there's some sort of hormone imbalance. And you can tie in joint pain to hormone imbalance just like you can tie it into something with the gut. So I think that was really interesting that people have these overt symptoms that they don't necessarily associate with functional medicine. Like they never even know that a gut problem can cause insomnia or a gut problem can cause inflammatory joint pain. So that's something that was eye-opening to patients. And as soon as you explain it to them, I think this is something that is exploding. As I mentioned, talk to us a little bit about like where you see this functional medicine program going in doctors' offices and some of the conditions that are some of the quickest ones to turn around. Like, for example, someone who's anxious, depressed, some of the things that we just mentioned. Like, where do you see this going in the short term?
Yeah, so I mean, the origins of functional medicine are dealing with really severe chronic illness, but clearly, it as you said, it's exploding now. Like the industry is going through this almost 25% growth year over year, and it's not slowing down. And I think that's because we're breaking away from just the chronic fatigue group and starting to look at the average American who has a weight problem, who, like you just said, has a lot of joint pain or headaches. Maybe they got COVID and they never really felt quite the same after that, but there's nothing medically wrong. They've got like heartburn, indigestion, constipation, diarrhea, bloating. They just don't do great when they eat food. And low sex drive for men or women, and these problems that they go to see the regular doctor, they get the workup and there's nothing wrong. They come to a functional medicine doctor and we're like, oh, okay, well, there's not a disease here. You're not going into the hospital for this, but there's definitely something wrong that we can fix. And to Buzz's point from earlier, your body should be healthy. If we just remove these blocks, then we see people heal and repair rather dramatically, rather quickly, and I think that the public is just so frustrated now with the disarray of conventional medicine. And we're increasingly getting so much more and more fat and sick and tired and metabolically unhealthy that it's just sort of functional medicine's time now to step in and make a big difference for that average person who's not chronically ill to the point where they can't work, but whose really, quality of life has suffered in terms of how they interact with their family and how they do their job and things like that.
Yeah. The testing, as you mentioned, picks up on some key markers. I was telling a patient this morning, in functional medicine, we look at the way stress impacts the system. And there's different types of stressors. The ones that are most common, people understand, are the emotional stressors, work, family, finances, but they don't realize that, stressors from the gut, from a parasite, from an infection could break down the body the same way. So I think the way people know that they either have high blood pressure or low blood pressure, they don't know exactly what it is every day of the week, but they generally know if it's high or low. They know if they have high blood sugar, relatively speaking. I think another hormone that they should be aware of, testosterone, cortisol, for example, going back to the body systems. People should generally know if my cortisol is high or low throughout the day because it has so many impacts. It kind of is the beginning marker that we look at with neuroendocrine. That's one of the first things that you taught us about the cortisol impact on the gut, on the liver's ability to pull toxins out of tissues. Tell us a bit about that, because people know cortisol, but they don't really understand the impacts that it has on the body.
Yeah, and I don't know if you guys were in the class this week, but we had like the best adrenal case of a long time. Super high functioning, super well established executive running all kinds of companies, and his cortisol test came back and it was just flatline. It was like the worst one I'd ever seen. And the doctor's like, wait a minute, he's not tired. And I'm like, well, yeah, he's running like 16 companies and he's got $1 billion. He's just burned himself out. So people can't feel or perceive, they know that something's wrong, but they don't know if their cortisol is sky high, which requires a certain treatment, or if it's dropped to an absolute abyss, which is a completely different treatment. And so if we don't do the testing, I mean, you can say that you're stressed and people can figure that out on their own. But if we don't do the testing, we don't know what the actual treatment program should be. And people can have super high cortisol and be exhausted every day. And that could be from, I don't know, it could be from working out excessively or, training inappropriately, or it could be from working too hard. It could be from having 3 kids. I think by the second or third kid, every parent, for sure, every mom has got high cortisol. I don't think, first kid you can get by, but by the time you have your second baby, your cortisol is going to be shot. And so what we're trying to look at with the testing is get a picture of where that person's cortisol is, which is going to affect things like mood, energy, fatigue, sense of food cravings, how much food you need to eat. Of course, cortisol regulates your metabolism. So if your cortisol is messed up, you're going to have a damaged metabolism, which means you're going to store body fat, not burn it, right? And so it's all these implications of it. Your sleep's not going to be that great. And then once, as you guys know, once you see the labs, you can say, oh, okay, this person's really high. Let's just give them a cortisol program that knocks the cortisol down, or the cortisol super low, like this executive we had the other day. Let's bring that person's cortisol up. And so it's science-based, but it also kind of acknowledges the reality, which is that a lot of us are really stressed out, but it's not so bad that you really need to go to the hospital, but you don't feel great. And you're maybe 10, 15, 20 years away from being in a serious medical condition. So why not just address it now and have that quality of life rather than just suffer through the day, as a lot of us are doing.
Yeah, I think a lot of people like what you're saying there too, Dan. These high cortisol levels, if you haven't had your cortisol levels tested, everyone should. Because as you said, if your cortisol levels are, if your adrenals and your cortisol levels are messed up, they affect the way you are for the rest of your life. And most people don't realize they have adrenal misfunction. And what happens is then the rest of their lives, they're overweight, they can't lose weight. They have all these other problems. Their immune system's down. They get sick all the time. All these symptoms that over time just wear you down. And people chalk it up as just because I'm getting old. No, it's not because you're getting old. It's because your system's broke down and needs fixed. It's not normal as you get older to get heavier and to have joint pain and to have no energy and not be able to sleep. Those are all telltale signs as your adrenals and cortisol is messed up. And I guess frustration as a doctor is it's so easy to diagnose and treat. So easy. Anyone can afford to do it. It's a simple saliva test we do in the office. And when you fix this, it's life changing. People have to realize this. And it's a simple test. Your regular doctor is not going to do it. It's not part of mainstream medicine because it's not going to kill you, but it affects your life in such a bad way.
Yeah, it is amazing. And I guess maybe that's what's happening now in the United States in general, which is this people waking up and seeing that, hey, these tests are available. I can get it. I think it's going to work, and then of course they have to, figure out what doctor is going to help them, and that's why I run my training program so we can train people and have a large enough group of doctors to handle this rush of patients that's starting to realize that this is, a viable treatment option for them. I really feel like we're in the very beginning stages of the uptick in functional medicine, even in the last 12 or 18 months. It's pretty dramatic to watch. And I guess
I
when
thought it was
you hear
interesting you
about,
said
yeah,
a lot
huh?
of your new people you're training aren't just chiropractors or naturopaths. You have vascular surgeons, you have podiatrists, you have all these, physical therapists, all these other providers who want to help people are participating in this program because what's happening is they realize, whether you're a medical doctor, chiropractor, or physical therapist, if you don't fix these underlying root causes, no matter what treatment you do, it's not going to work long term. So really, every doctor should know functional medicine if you really want to fix people long term.
Mm-hmm.
Yeah, and in fact, I think functional medicine is just good medicine, period. And the very interesting thing, and I think our current conventional medical system is so broken that even the people running it, the medical doctors, nurse practitioners, PAs, DOs, are bailing out. They're just like, this is an untenable system.
You see
I'm
that?
not going to fix it from the inside. I'm just going to go help people. And how am I going to do that? And then they find functional medicine. They're like, okay, this makes a lot more sense. And what I hear from medical doctors all the time is, hey, I'm taking your class. This is why I went to medical school. I
Yep.
wanted to understand what is going on with people and I wanted to help them. I didn't sign up and go to medical school so I could prescribe drugs in a 6 to 8 minute visit, for 80 hours a week. That wasn't my vision when I was. And so I feel like functional medicine offers so many things to different types of providers. And I feel like we owe it to our patients too, right? To learn these things. Like you said, it's cheap, it's easy, it's effective. It can keep you off of all the pharmacy that people get into, the polypharmacy and all the multiple medications that we see so often. It just makes common sense.
I know our goal is to change the mindset of people doing testing only when they're sick to doing testing when you're healthy, so you don't get sick. We're kind of running outside of that insurance model. If you think about insurance, the treatments that the insurance companies neglect are often the ones that you need that will make you heal the fastest. So getting people to understand that, insurance is more like a sick care, medicine, surgery type care, but there's a whole array of health benefits that are accessible to you that, like you said, are so affordable that everybody can have access to these. And changing that mindset, like I said, to testing when you're healthy so you can stay healthy or get healthy versus doing traditional tests when you're sick to manage the symptom as your health slowly declines over time, to Buzz's point, that's not the norm. It's the common, people accept that as average. That's what happens to everybody, but it's definitely not the norm.
Yeah, I think it's interesting too, because I think that, I don't know, I get too cosmic, but I think, the awareness, I was going to say consciousness, but the awareness of people and how they need to look after their health. I think COVID really shifted everyone's mindset just a little bit. And
I
people
agree.
realize that, wow, if I'm metabolically unhealthy and I get a virus, I could die. And
Mm-hmm.
oh gosh, that guy that works out in the gym every day, that takes vitamin D and is metabolically fit, he got COVID and he was fine. You know, and there's all kinds of studies that showed that many, if not almost all of the people that died from COVID were metabolically unhealthy before they got it. And so I don't know why it took like a worldwide pandemic to bring this up, but I think it just brought into everyone's consciousness that just walking around not being healthy, but not being sick enough to go to the doctor is not a great place to be, you know?
Mhm.
If only for your mood and your anxiety levels and your depression and how you treat your family and, you know, even just how you're feeling day to day, that can be up leveled so much with these programs. You know, there's no reason not to do it, really.
You know, the
When
diet, exercise, sleep, meditation, all those things. One of the best parts of functional medicine is that as the body gets healthier, you withdraw a lot of the supplements. You know, you don't, like you said, the goal of a good functional medicine doctor is to get the body to heal as fast as it can, as well as it can, and maintain it with the least amount of supplements as possible. And so people really like that. And it's the exact opposite of what you said. Like we all recognize what happened during the pandemic. Get a shot, you're immune from everything. You don't have to exercise. You don't have to interact with your friends. Like if you want to figure out a way to get people really unhealthy in a short period of time, follow exactly what the traditional protocol for COVID was. And if you want to figure out a way to get really healthy really quickly, do the exact opposite, it seems like. You know, interact, get outside in the environment, boost your immune system, spiritually connect with your friends and loved ones. God, it's crazy how that happened.
Yeah.
Mhm. Yeah. So real quick, I know that when we started looking into functional medicine with the programming, and then you started doing Dr. Dan Kalish's programming, and he said just start. And so we actually started with our family, and because our boy was like complaining of his back all the time. And we were like, oh my God, you're only 16. And so Buzz did functional medicine testing on him. And then it just so happened that in my career, I was having like just a total meltdown in my career and it was stressful. And we did functional medicine testing on me. So we're going to roll right into part two on
Okay.
this. So I want us to run through some sample patients and symptoms and suggested testing and treatment plans. And I thought maybe Dr. Dan Kalish, if you have some good ones, you can talk about those, but just our own too.
Mm,
So,
that sounds
and
great.
Dr. Joe, if you have some. So,
Awesome.
yeah, you start one.
Okay, so we're going to part two. Okay,
Yeah,
sorry.
we're going to
So
part two
we'll
right
go
now.
to my son Brock, who's 16 at the time,
Yeah, 16.
probably 16 at the time, and was always complaining of back pain, shoulder pain, every pain in the world. So, but I'm like, how the hell can a 16-year-old have back pain, shoulder pain, all this different stuff? So, we did the adrenal test, gut test, organic acid testing, and he came back. He had like I think he had H. pylori, Giardia, all these gut infections. Now, mind you, he's 16 years old, and he doesn't eat really bad.
Mm-mm.
I mean, I'd say is but more average than average 16-year-old, right? I would say
Right.
like we eat good food, and he had these infections. So the first thing comes to mind is if he had these infections, wouldn't his stomach be upset? No, you can have a gut infection or a GI infection, and not your gut doesn't have to be upset. It could manifest itself as systemic inflammation or pain. So then I'm thinking to myself, how many patients have I treated in the past with chiropractic and physical therapy that no matter what we did, they just didn't get better? But we didn't have these tools in our toolbox to say, okay, you're not getting better. There has to be something else going on. And in his case, it was systemic inflammation from his leaky gut.
Mm-hmm.
So, anyone listening to this, if you live in chronic aches and pains here and there and everything. And once again, it's not a factor of aging. When you get older, you're not supposed to have aches and pains. It's just as you get older, you're more likely to have these infections. And if you have an infection, it doesn't mean you'll have an upset stomach. Most people don't. Most people are asymptomatic, I would say, GI wise, but it manifests itself in other ways. Either their autoimmune conditions are flared up. Like autoimmune conditions do amazing with us.
Mm-hmm.
Rheumatoid arthritis, scleroderma, psoriasis. Dan, you could probably speak to this too. Anyone with autoimmune that you fix their gut, you can't reverse the autoimmune, but you substantially and sometimes put those conditions in remission.
Yeah, it's pretty dramatic. I think autoimmune, I guess you could say it starts in the gut,
Mhm.
and it
That's the
certainly can
gas for
spread.
the gas for the fire.
Yeah, it certainly can spread to other areas and be more complex than just gut, and is most of the time. But if you don't correct the digestive tract, you're really screwed. And then the other thing is that like your son is a perfect example of the main premise. I talk about this in class a lot, is that we do GI testing on everybody. We don't just do digestive testing on people with digestive symptoms, because the whole point is that the symptoms are not an accurate reflection of what's happening in the first place. That's like your least stable
Most
way to
people don't have
monitor.
GI symptoms that we find gut problems with.
I know, is that
So if
crazy?
you're
Can you
listening
believe
to this,
it?
don't say, "Well, my stomach's good and I can eat anything. I'm fine." Like you can't use GI symptoms. Heartburn isn't a sign. Like if you don't have heartburn, you're good. No, that doesn't work that way. They're not connected.
Yeah, it's hard to see that because we're so used to the idea of, you know, the two having to be connected, symptom with the problem.
Well, look at. I
And
mean, the other thing I can talk about is people that have depression or things like that. Like serotonin and dopamine, a lot of it's produced in the gut. So if your gut's messed up and you don't produce, proper amounts or proper balance of serotonin or dopamine, obviously it can affect your mood with, ADHD, depression, all these different things, right? So, and traditional medicine doesn't even look at the gut. So as soon as you have depression or ADHD, they give you some type of medication to try to mask it or do whatever. Why not go? I mean, once again, it's not normal to have ADHD. It's not normal to have depression. Let's check and make sure there's nothing malfunctioning with the body first and fix that and allow the body to heal itself. That's the premise of functional medicine.
yeah. How about you, Joe? You have some cases in mind?
I had one of the other test models that you said, the liver detox, pulling toxins out of tissues. I had one particular lady that I take care of that was a high-level fitness competitor. And you would think by looking at her, nothing could be wrong. And we did the test not because she was sick, but because she wanted to optimize function. And when we looked at her oxidative stress or the accumulated damage on the cell system, hers was one of the highest that I had ever seen. Totally unexpected when I was new into this. And we looked at her mitochondria, her capacity to heal and regenerate. That took a hit as well. Those are some of the most interesting cases that people could use to test themselves. So in any event, when we wound up giving her some antioxidants, things that she was taking in her diet, but not nearly in the dosage that she should to reverse some of the cellular damage. Her joint pain got better, her skin cleared up, her sleep pattern improved. And you would think, these are supplements that are commercially available. Most people that have functional medicine type conditions, the supplements that they take as part of a multivitamin are not nearly enough to help reverse or correct the deficiency that they have initially. Like, for example, protein. Like this is a really interesting one too. The same lady tested her and she had an infection of H. pylori. As Buzz said, she didn't have any symptoms, but one of the things we came to learn was that H. pylori interferes with the body's ability to digest proteins and amino acids. So this is where it gets interesting and fun for us as doctors, is that, okay, so she's not getting enough protein, she's eating enough, but she's not digesting. So the steak that she eats is not getting converted into enough red blood cells to stimulate her brain or help with her recovery. The steak that she eats isn't turning into the neurotransmitters to help her sex drive. So it's amazing how when we looked at this and we ran all three body systems, we approached it where I took some of the symptoms that she was experiencing, the joint pain, inflammation. We treated that last body system first, symptom-wise, increased the antioxidants. We fixed her adrenals, and we worked into the gut and eventually reset the liver's ability to pull the toxins out of tissues. And this lady who had no symptoms has turned into my biggest referral.
Wow, that's
All of
great.
it, her marriage is better, her exercise is better. Just, it's amazing that I think you had said this, Buzz, that why would people take lots and lots of vitamins without ever doing a test to see which ones you need and see which ones you don't need? If you just taking our hat off and say we were, cardiologists, would we ever put somebody on a calcium channel blocker or a beta blocker if we didn't do testing, if we didn't know what their blood pressure was, if we didn't have information about them? Vitamins are the same way. The impact is so significant to take precision nutrition for your deficiency. It works better than taking a broad spectrum. You could be taking the exact same vitamin cocktail from the time you're 16 to the time that you're 50, but your needs change. The dosages change. The types of vitamins that you need change. And when you can hone in on that, the quality of life is enhanced. So like, that's just one example. But people who had joint pain, back pain. I have another case that this person had a 4 millimeter disc herniation in the lower back, screaming sciatic pain on the right side. We had the MRI on this. We ran them through a protocol of spinal decompression. Patient did well. About 60% of the pain subsided. But during the intake, when I asked them, I said, hey, this is going to sound off topic, but talk to me about your gut. This person did have persistent constipation lifelong. And during the time that they were finishing their protocol, I got their lab tests back, and we wound up fixing the gut. And 3 months later, that 40% of the back pain that didn't clear through decompression cleared because we fixed the gut. So, you know, for the people that are out there listening, if you have a symptom, assume that there's a gut problem. You know, everybody should be tested using these symptoms or these tests, as you mentioned earlier. And we didn't touch on it a lot, but the organic acids, the amino acids, Dan, like that's one of the things that you said you got into the latest, in the latter part of your career. But some of the things that you love the most, because that tells us from that one test, you can tell about metabolism, about the function of the brain, about the gut, about the nutritional absorption and digestion, and even what the liver is doing. So,
I
if
love
people
that.
don't know what to do, right? Is that where would you? How about this?
Yeah.
So we talked about a couple of cases, great results. If people don't know what to do and they're kind of dipping their toe into functional med, like where would you start for the person that says, like, should I do all 3 tests at one time? Should I start with just the gut? Like, what have you found to be most successful for the novice patient that doesn't necessarily have a lot of symptoms that they know about?
Yeah, so let's assume that you're over time going to do all 3 tests. Okay, starting with the gut is what all functional medicine doctors recommend, and that's the worst place to start, because if you're going to do just a gut test and try to correct that, what actually needs to come before that is the lifestyle change and the management of the adrenal glands, because that's what sets you up for the gut programs to be successful. So you could do a gut test, and okay, we can agree that's the most important thing. But if you jump in and start the treatment there, the odds on it working are pretty slim, because
I
the
think you
gut
said,
problem,
Dan,
right?
when that you'd mentioned a lot of functional medicine doctors start with detoxing people, which
That's actually dangerous. Yeah, that one's bad too.
yeah, and I thought that was interesting because I know a lot of functional, there's a lot of people do functional medicine, but I don't know that a lot of people are really good at it. And I've heard of a lot of patients that come through here that went to functional medicine doctors and they did a detox first and felt terrible and never followed up. Maybe you can explain a little bit
Yeah.
why it's a bad idea just to randomly jump into a detox.
Yeah, so my teacher, Dr. Timmons, learned this in the 1970s in these detox clinics that he was running, is that they thought detox was the most important thing. I can agree with that. But they started to detox people before they did any kind of preparatory work. So if you free up environmental toxins like mercury or lead or benzene or toluene, you pull them out of the tissue and then you just let them circulate throughout your body. That's actually going to make the person worse. They're going to feel worse, and it's not good for their health either. And so what Timmons learned back in the 70s was that we had to prepare people for detox. What you have to do first, you have to get their gut working, because a lot of the toxins are removed or eliminated through the gut in the first place. So that's got to work. But you can't start with the gut. They learned this one the hard way too, because if you do, before you got the adrenals working, it's very likely that the gut infections will just come back, because you need to strengthen the immune system, which happens with the adrenals. So around the 70s and 80s, by the early 90s, this was figured out that if you start with the adrenals and lifestyle, that leads you to then successfully be able to do a gut program. That leads you then to successfully detox a person, and you have the fewest number of patient complaints this way, fewest number of side effects. It's quite efficient, it's quite fast, and you're sort of setting the person up for each stage by doing the preliminary work first. And if you get the sequence wrong, it's just you're reducing the odds that the program's going to work, and it's very frustrating for patients.
I agree.
I think, Joe, you explained sequencing well. I know we talk about that when we're dealing with disc herniations. You want to go over that real quick?
Yeah, just to give an analogy is, Buzz and I, like you said, we've basically have the exact same practice. We've been best friends for, it's got to be about 25, 30 years. I don't even know how long, Buzz, and we've always kind of gravitated towards the same things. And this is how kind of we fell into functional medicine again is, to give an analogy of what you said. If someone has back pain, for example, you're always one diagnostic test away from healing yourself. So most people will just take x-rays or none at all. So for example, the traditional insurance-based model is if you have back pain, treat it for 6 weeks with physical therapy and medication management. When that fails, then we'll do a diagnostic test. It's almost the exact opposite of what you think would really make sense to heal quickly. So when we do find out that a person has a disc injury, the treatment that we utilize, spinal decompression, is designed to help the disc heal. And it's the sequence that you approach this treatment that makes all the difference for the outcome. So for example, what are the other treatments that are available? You have physical therapy, you have chiropractic, you have massage therapy. If you supersede spinal decompression with physical therapy or with chiropractic, you disrupt the sequence. You're not going to have a good outcome because a disc itself is unstable. And you can make the analogy, if somebody had a broken bone, you can be an osteopath, a chiropractor, or a cardiologist. Everybody agrees you're going to put it in a cast for 6 weeks to stabilize it and let it heal. For a disc, it's really a similar type of approach that should be involved in healing. Every time you do spinal decompression, the disc gets stronger and stronger and stronger. And once it becomes stable, then your physical therapy, then your chiropractic works better and better and better. And so, the approach to your point, Dan, doing these things in sequence makes all the difference in the world. I could tell you when I was new into functional medicine, I would constantly get the same tests that we're using today thrown on my desk. People would do all the testing and they'd never start. To your point, Buzz, like they'd be given a ton of medications, or not medications, it's supplements, and they would treat all these systems at the same time, which is another thing, Dan, that people have had not the greatest experience. So functional medicine doctors are not all the same. Just because you go to one and it doesn't work doesn't mean that it's not for you. We used to make this analogy with chiropractors. Chiropractors aren't all the same. If you went to a bad one, consider using another one. If you go to a bad movie, you don't stop going to movies forever. You just find one that you like. So we're so grateful we found you and we can pass your knowledge on to our patients. Like, what do you think makes the best functional medicine doctor? What should patients be looking for?
Yeah, someone who's been mentored by someone who had a lot of experience. I mean, it's probably the same for plumbers, electricians, and car mechanics. Not someone who is self-taught, but someone who found the best carpenter in town and spent 10 years following them around in a pickup truck and learning how to really do the job right. And then they come into your house, they look at it, they're a craftsman, they build it right, they know what they're doing. And I don't think that's a new idea. This goes back to like guilds and like medieval times or something, right? Like people learn by having a senior person around. And I was very fortunate in the days when I was coming up. Like I said, I was in San Diego and there was like 10 of them around. And I worked with 2 of them, for 6, 8 years, full time as a mentor. And then now I want to try to mimic that with my online training program, but it doesn't have to be with me. If you find any senior practitioner who's been in practice for 20 plus years, they can show you the ropes and tell you what works and doesn't work. But the problem that we're facing now is there's so many patients that want functional medicine, that there's so many doctors that are entering into functional medicine and they have zero training in terms of a true mentorship or clinical application. They may take some academic courses, or they may even get certified at an academic institution in functional medicine, but they have zero in the trenches training. And as you know, as chiropractors even, right, you had to follow a senior chiropractor around to learn how to do this. It's really the way that human history has evolved, as we learn from the people that are masters. And I think we're missing that in the profession now. And so if you can find somebody though that's certified by me, or that has evidence that they worked under somebody for 5, 10 years and really learned the ropes, then you've got it made, because those people are all competent.
Yeah, Buzz, you had mentioned earlier how we had been involved with functional medicine for a long time and we just never really put it together. We even completed a fellowship in functional medicine. So it's a lot of information that you're taking together. But I think, Dan, the best thing about working with you for the last year plus now is not just the coursework and curriculum that you provide to us, but the once a week review of labs. So I feel like we're in the process of becoming much more seasoned than we were before, because we've seen many, many more labs than we've had as patients, because every Tuesday night it's a topic of discussion. Somebody had an issue with a patient and a great adrenal case, or someone had XYZ gut case. So the benefit of seeing labs over and over and over, you start to see patterns, which is amazing. So I think there's probably going to be a bunch of doctors that see this. Talk to them just a little bit about your course, your curriculum, and how it became so digestible for me and Buzz, who aren't the easiest students. We kind of have that ADD and kind of skew left, right, somewhere in between.
Yeah, so I have the 1 year mentorship. There's an online curriculum, but honestly, most people don't even go through that whole thing, because what they really do is they show up for the Tuesday night class or Wednesday morning class, and they just learn in real time. And I think that that's just how doctors are. If you're under the gun, you got a lab, you don't understand how to interpret it, you go to class, you learn pretty darn fast. And you also then hear 6 or 8 other doctors who are panicking because they don't know how to interpret their lab. And you hear that. And you hear that over and over and again for a year. I think the average mentorship program person in my class hears 400 to 500 cases in a year by attending their live calls. And that's the equivalent. I was talking about this morning about this with another doctor. I mean, how long did it take me before I had 400 or 500 of my own cases? Like a long time,
Right.
years. And in a year, you just got dumped into your brain, and that clinical knowledge sticks. There's actually research on this where they call it active learning. Or if you're just like reading a book and learning about something, that's one thing. But if you're in class and you're under the gun and there's a lab in front of you, your learning accelerates by like 3 to 4 times. And doctors just don't forget cases, right? And so this case-based learning. And even though it's a little panicky because you're often confronted with something that you don't know the answer to, but that's when you really learn, right? When you you don't know it, you hear what it is, that just stays in your brain forever. That's a lot different than reading the same set of facts that just kind of comes in and out. So yeah, I think the live calls, and I've tried to do this recorded, doesn't work. You got to be on the call live. It's the strangest thing. It's something about the human brain. You could listen to all these recordings of the live calls, and it doesn't have the same net effect as when you're actually on that call participating. You're maybe a little worried. I'm going to ask you a question. So you're thinking, you're wanting to pay attention. And that participation really is, I think, what makes it. So I think my 1 year mentorship could probably get people to where I was around year 4 or 5, just because it's so condensed.
Yeah, and what I love too about the class, I'd be sitting in the corner and I'll be listening to everyone's cases. And then it's muted, of course. And so me and Buzz will be talking about like, what is it, or what's the programming, or what should they do? And then Dr. Joe is texting Buzz about it. And so it's real fun. It's exciting.
Dan, and here's a crazy thing. So Daniela has no medical training, but just by
No.
listening to all the classes with me,
Yeah.
I always say, "What would you do?" And she's spot on with cases. So like she knows everything as a non-physician. What's your college background? Was like
I went to the Ohio State University and I graduated in the human ecology program for nutrition and exercise science. But
she knows.
Okay.
I'll
Yeah.
quiz her. What would you do? How would you dose this person, that person? She's spot on every time, which is crazy just from listening.
well,
That's
we
awesome.
we get calls all the time because we're helping people with arthritis and just different conditions. And they'll be talking to me, and I'll always say, we'll have doctors call me and nurse practitioners, and they'll be asking me about their patients. What would you do? And sometimes when they're telling me everything, I'll even say, well, have you done functional medicine? And then I'll start talking to them about functional medicine. So every time I talk to somebody now, whether it's the gym or my friends or people in public, I always talk about functional medicine. And they'll be like, what's that? And then I'll explain to them what it is. And then, they'll say, well, how'd you find that out? Or what'd you do? And so we talk about you all the time. And I always tell them about you. So,
And I think maybe on another podcast, I know we have to wrap up pretty soon. Dan's actually spearheading a project called Mainstay Health. Is it Mainstay Health?
Yeah. Yep.
Yeah, where it's going to open this up for more providers because I had expressed to you, Dan, every week we do a lot of training with medical doctors all across the country, and I can't tell you how many times a week the conversation rolls back to functional medicine. Do you do functional medicine? No, and it's dead ended, and they feel defeated because they know they need it, but they can't figure out how to do it. And I only have so much bandwidth, but you've come up with a system that I think we may talk about on another podcast, how you're going to be able to get your knowledge into their offices with providers certified by you so we can get this functional medicine out there to help more people. I think it's going to be amazing.
Yeah, that's really exciting. I'd love to come back and talk about that next time.
Yeah, for
Yeah.
sure.
Yeah, because that's awesome. Because we have our own doctors that call us for products and things, other businesses that we do. And they'll be calling me and they'll be like, hey, can you help us with our patient? So we're helping other doctors with their patients do functional medicine because they don't understand it. And I'll
Yeah.
always say, you should go to Dr. Dan Kalish's programming. That's where we are learning our mentorship
But a
from.
lot of doctors, it takes at least a year to get there, which they don't
Yeah.
have a year. They have a patient that has a problem today.
Right.
Mainstay is going to solve that problem. So
Yeah,
I'm
that's
really excited to talk
exciting.
about that.
Yeah.
Yeah. Thank you.
Wow. Well, I'm very thankful that you came on our podcast and, just shared everything with us today. It's so exciting because when I saw your name on here, I was like, oh my gosh, I am so excited.
Yeah, you're famous at our house.
You are seriously famous at our house. We talk about you all the time to everybody. So really, thank you for being a part of our podcast today, Dr. Dan.
I appreciate it so much, you guys. Thank you.
Yeah, thank you.
And thanks, Joe.
All right. Great
All
seeing you
right.
guys.
Thank you.